Okay, good morning everyone. So I'm here to present a case, actually a story of a hare and a turtle. So a 52-year-old female walks into the OPD with diminution of vision in the left eye since 3 days. History of trivial trauma to the left eye 20 days ago, which was not significant. On examination, her visual acuity in the right eye was 6's, in the left eye was 618 with no improvement with pinhole. Pupil had RRR in the right eye, and in the left eye there was grade 1 RAPD. Color vision had no defect when it comes to the right eye, and when in the left eye it had red-green defect. Contrast was normal in both eyes, and posterior segment evaluation was normal in both eyes. So these are the clinical picture of the patient. Her versions were normal on the outset, but when we look at the horizontal movement of her eyes, here we can see that the left eye had a lag when it came to the lateral movement, whereas the right eye medial rectus was moving in a very good manner. So the hare in this case is the right eye medial rectus, and the turtle, which is slower, is the left eye lateral rectus. So there was a lag in this movement in the yoke muscles. So we got an MRI done, and it said that there was a lateral rectus enlargement at its belly and not in the tendon. So it was compressing the optic nerve at the orbital apex, and the lacrimal gland in the left eye was enlarged and was hyperintense on T2. All the blood tests that we did, the chest X-ray, first line, second line for the autoimmune diseases also was negative. So we didn't find anything positive in that. So let's come to the course. Oral steroids were started, 1 mg per kg, and the patient was symptomatically better. She was sent home. After 2 months, the patient's symptoms recurred. But this time around, the color vision was normal. So we got a new information that she was on Ayurvedic medication 6 months, from 6 months, but that was not again significant. Her lag in the left lateral rectus was still present. We got a repeat MRI done, and there was only decrease in the size of the lateral rectus, but the lacrimal gland enlargement remained. So she was admitted, IVMP was given for 3 days, her vision came back to 6.6, and the color vision again was had no defect, and that lag that she had in the initial presentation was absent now. So working diagnosis of left eye non-specific orbital inflammatory disease was made. At this point, what more could have been done? A biopsy could have been taken, a full body CT could have been done, and IgG4 should have been done. So 1 year passed by, the patient never came back, and then again she comes back with the same complaint, but this time with full-blown redness, proptosis, and everything which suggests lid edema, which suggests inflammation of the orbit. So what next? We did serum IgG4 because the lacrimal gland was still inflamed. It was negative. So what is unique about this case that it is one of the very few, actually the only NSOID that I could find on the internet which has a presenting complaint as a diminution of vision, because all the others either have pain, redness, proptosis, lid edema, pain on movements or restricted movements. No one ever came with diminution of vision. So what's the take-home message? So inflammatory signs need not be the first symptoms, as in this case it came after an year. 1/4 of the cases are refractory, so once a patient can always come back. Time of starting of steroids depends on the case. It's very particular. There is no fixed regime for that. Thank you.